Welcome to a new and rewarding chapter in your nursing career, Independent Nurse Patient Advocate. As nurses, we're the cornerstone of patient care, ensuring the well-being of those we serve. However, the healthcare system can be complex and overwhelming for patients and their families. This is where the role of the Independent Nurse Patient Advocate becomes crucial. We will begin by reviewing the evolution of patient advocacy. In the 1960s through the 1980s, there was growing concerns about patients' rights and medical ethics. Early patient advocacy roles were often filled by nurses, social workers, and volunteers. People began to have increased awareness of their rights, informed consent, and the need for support in the healthcare setting. By the 1990s, patient advocacy began to formalize as a profession. They were referred to as patient representatives or ombudsmen. They played a key role in addressing complaints, resolving conflicts, and improving patient satisfaction. Managed care and complex health insurance and billing systems increased the demand for patient advocates. Patient advocacy organizations such as the Society for Healthcare Consumer Advocacy were formed to provide training, networking, and certification. Healthcare options such as outpatient care and home health services expanded the role of patient advocate beyond the hospital. Patient advocates now work in a variety of settings, including insurance companies, legal firms, nonprofits, government agencies, private practices, and as independent consultants. The internet and social media has empowered patients to be more informed and active participants in their care. This created more opportunities for patient advocates to assist with research, treatment decision making, and accessing resources. To show you a personal story regarding how patient advocacy has expanded, a lot of people remember Ken Schuler. Ken Schuler was a consultant for UNICEF and had a scientific background. In the 1990s, he was diagnosed with lymphoma, and because of his background, he was able to research about lymphoma and ask the right questions. He wondered what other people that didn't have background that he had. He wondered how would they ever navigate. So he began to advocate for himself and others, and so began the profession of patient advocacy. Next, I wanted to discuss the standards of practice framework for independent advocates. In 2007 and 2008, healthcare definitely became more complicated, and more people began to start advocacy businesses. These people began to network, and two organizations were launched: ADVO Connection, which is now AFA Umbra Health, and the National Association of Health Advocacy Consultants, or NAHAC. Around this same time, Ken Schuler, as we spoke about earlier, was asked to oversee a committee to establish a code of ethics for patient advocates based on the Golden Rule, and asked that it be client-centered, value-based, and integrity-based. They adopted much of Ken's code. It required a membership to agree to the code. It did not require you to be an independent advocate. Next, a second code of ethics was developed called the Health Advocates Code of Conduct and Professional Standards, and it was modified and simplified. As standards were being created, a Patient Advocate Certification Board, or PAC board, was established. And this board developed certification criteria and an exam for patient advocates. You do not have to be certified to function as a patient advocate, especially if you're already a licensed medical professional, such as I am as an RN. Becoming certified does show that you support the profession of patient advocacy. Next, I'd like to discuss the Code of Conduct. The Code of Conduct that we utilize as the standards of practice are ethically based on best practices, and best practices are our guidelines. The next 10 slides discuss the Code of Conduct and best practices. The first standard of practice discusses the professional conduct and ethics. It describes that we should be client-centered and provide client-centered care, that we should maintain confidentiality, informed consent, and avoid conflict of interest. Number 2, competence and professional development. Ongoing education, including attending workshops, seminars, conferences, and obtaining certification. The scope of practice. You should operate within your scope of expertise and competence. Seek guidance or refer clients to other professionals. Certification and credentialing. Obtain and maintain certifications. Number 3, transparency and disclosure. Clear communication with clients about their services, fees, and limitations to manage expectations and build trust. Fee structure and billing structure. Advocates must provide clients with an itemized list of services and costs and obtain a client agreement on payment terms. Disclosure of limitations must be disclosed to the client at the outset. Number 4, client advocacy and empowerment. Empower clients to make their own informed decisions about their health care. Respect for autonomy. The client's right to self-determination is fundamental. Effective communication and coordination. Facilitate clear communication between clients, healthcare providers, and other stakeholders to ensure coordinated and effective care. Number 5, confidentiality and privacy. Data protection and compliance with regulations are important. Be familiar with and adhere to relevant privacy laws. For example, the HIPAA. Number 6, documentation and record keeping. Be sure that you have accurate record keeping. Maintain detailed, accurate records of client interactions, decisions made, services provided, and any other relevant information. Secure storage of records. They must be securely stored and retained for an appropriate period per legal and ethical guideline. Number 7, collaboration and coordination of care. Effective collaboration is key to providing comprehensive support. Coordinated advocacy effort is utilized to prevent duplication of services and ensure seamless care. Number 8, responsibility to the profession and to the community. That includes professional conduct. We should uphold the reputation of the profession by acting with integrity, honesty, and professionalism. Advocacy for the profession. We should contribute to the growth and development of the profession by participating in professional organizations, mentoring others, and advocating for patient rights and quality health care. Number 9, cultural competence and sensitivity. Be sensitive to cultural, ethical, and socioeconomic diversity among clients, and ensure all clients have equitable access to advocacy services. Number 10, quality improvement and accountability. Continuous improvement. This helps ensure clients receive the best possible advocacy support. Accountability for actions. Advocates must take responsibility for any mistakes or oversights promptly and professionally. One of the essential skills for a patient advocate is understanding different types of health insurance coverage, including Medicare, Medicaid, and private insurance. Knowledge of these programs allows advocates to guide their clients effectively, ensuring they receive the care they need and understand the coverage options. The next few slides show the importance of understanding these insurance types, the difference between them, and how this knowledge impacts patient advocacy. First, we'll talk about Medicare. Medicare is a federal program. It's primarily for people age 65 or older or those with certain disabilities, and it has 4 parts. Part A is hospital insurance, Part B is medical insurance, Part C is Medicare Advantage plans, and Part D is prescription drug programs. Medicaid is a joint federal and state program for low-income individuals and families. Eligibility and benefits can vary significantly from state to state. Advocates need to understand state-specific rules to help clients access and maximize their Medicaid benefit. Private insurance. It's offered by private companies and available to individuals through their employer or the health insurance marketplace. It offers different coverage rules, network restrictions, premiums, deductibles, copayments, and coinsurance. Advocates must understand the specifics of each plans to guide the clients in choosing the appropriate plans and managing the out-of-pocket expenses. So we need to understand insurance plan components so that we can properly advocate for patients. Premiums are regular payments required to maintain insurance coverage. Deductibles are the amount a client must pay out of pocket before insurance starts covering the services. And copayments and coinsurance are fees paid by the client for specific services with the remainder covered by insurance. Advocates must also understand the role in appeals and denial management. Patient advocates often help clients who face denials of coverage. Must have an understanding of policy terms, and the appeals process is crucial to this. Advocates guide clients through gathering the necessary documentation, preparing appeal letters, and following up with insurance companies. This knowledge empowers clients to access necessary treatments that might otherwise be denied. Medicare Advantage plans. They're offered by private companies as an alternative to original Medicare. Often includes additional benefits but come with network restrictions and different cost-sharing rules. Medigap. That's a supplemental insurance that covers gaps in the original Medicare, which is Parts A and B. Advocates help clients understand Medigap policies to manage out-of-pocket expenses more effectively. Becoming an independent nurse advocate is a meaningful career choice that allows you to leverage your nursing expertise to help patients navigate the complexities of the healthcare system. Here are some steps you need to take to transition into this role as a patient advocate and/or a business owner. Talk about the steps you need to take to transition to becoming a nurse patient advocate and business owner. First of all, you should develop your clinical background. Understand the role and the scope of patient advocacy. Obtain additional education and certifications. Develop a business plan. Secure necessary legal and professional protections. Establish a network and collaborate with other professionals. Create a marketing and outreach strategy. Refine your practice. Stay current and expand your services and grow your business. I want to interject here that on this learning platform, we offer some mini courses on everything about business because I wanted to share with nurses some resources, because when I started my practice, there wasn't anything out there like this. So I'm hoping that's helpful if you're going to move on and start your own business. From an administrative and management perspective, independent nurse patient advocates need to maintain detailed records of their work to ensure effective case management, maintain legal and ethical standards, and ensure accurate billing for services rendered. Next, we will review the key practices for keeping track of work and billing as a patient advocate. First, I want to talk about case management and documentation. So you should utilize a case management software system. It should be specifically designed for patient advocates or similar professions like social work or legal advocacy. These tools help track client information, manage appointments, document communication, and organize case notes. Popular options include Avocacia, CareNav, Practice Better, and Health Advocate Pro. Me personally, I use MyJunna, and they can be found on the internet. It's MY and then JUNNA. These tools often come with templates for care plans, consent forms, and other essential documents, making documentation more efficient and standardized. Client records and case notes. Maintain detailed records for each client, including personal information, medical history, contact information for healthcare providers, insurance details, and any signed consents or privacy forms. Document all interactions with clients, healthcare providers, and other relevant parties. This includes phone calls, emails, meetings, and any advice or information provided. Detailed notes help avoid misunderstanding and provide a paper trail if needed for legal or ethical purposes. Care plans and progress notes. Develop individualized care plans that outline the advocacy goals, actions, and timelines. Update these plans regularly to reflect progress, changes in the client's condition, or changes in the care needs. Use progress notes to track each step of the process, including research conducted, meetings held, decisions made, and next steps. Secure storage and confidentiality. Ensure all client records and notes are stored securely in compliance with privacy laws like HIPAA. This includes using secure encrypted digital storage or secure physical filing systems. Implement access controls and protocols for sharing client information to maintain confidentiality. Accurate billing is essential for running a sustainable independent advocacy practice. Here's how patient advocates manage billing and invoicing. Time tracking. Use time tracking software to record the time spent on the various activities for each client, such as research, consultations, coordination of care, meetings, and phone calls. Set up categories or tags for different types of activities to help in analyzing where most of your time is spent and adjusting service fees or processes accordingly. Billing for services. Hourly rate. Many independent patient advocates charge an hourly rate for their services. When billing hourly, time tracking is critical to accurately reflect the work done. Include detailed time logs with descriptions of services provided when sending invoices. Flat fee or retainer. Some advocates charge flat fees for specific services, such as a one-time consultation or developing a care plan, or offer retainer-based services where clients pay a monthly fee for ongoing services and support. Define the scope of your services covered under a flat fee or retainer to avoid misunderstandings. Package pricing. Offering a service package like new diagnosis support, insurance navigation package. These can be appealing to clients. Clearly define what each package includes and any additional charges for the services outside the package. Invoicing. Use invoicing software such as QuickBooks to generate professional invoices, track payments, and manage overdue accounts. These tools often integrate with time tracking software, making it easier to bill clients accurately. Include clear details on each invoice, such as the date of service, description of services provided, time spent, and hourly rate if applicable, total amount due, payment terms, and methods accepted for payment, such as credit cards, bank transfers. Accepting payments. Offer multiple payment options for clients, such as credit or debit cards, electronic bank transfers, PayPal, Venmo, or checks. Digital payment platforms can simplify transactions and reduce administrative overhead. Consider using a payment processor that integrates with your invoicing software to automate payment tracking and send reminders for overdue payments. Legal and ethical considerations. Contracts and agreements. Draft clear contracts or service agreements that outline the scope of your services, fees, payments, terms, cancellation policies, and any additional charges. Have clients review and sign these agreements before starting services. Update agreements regularly to reflect any changes in services, pricing, or legal requirements. Ethical billing practice. Ensure transparency in billing by providing itemized invoices and explaining charges clearly to the client. Avoid surprise billing by discussing potential costs upfront and obtaining consent before providing additional services that could incur extra charges. Be mindful of potential conflicts of interest, such as receiving referral fees from healthcare providers or other professionals. Maintain transparency and prioritize the client's best interests. Tracking outcomes and reporting. Keep track of the outcomes of your advocacy efforts, such as successful insurance appeals, improved care coordination, or enhanced patient understanding of their condition and care options. This not only helps in assessing the effectiveness of your service, but also provides valuable feedback for continuous improvement. Consider using metrics like client satisfaction, resolution rates, or time to resolution to gauge success and identify areas of growth. Reporting to clients. Provide clients with regular reports summarizing the work done, progress made toward their goals, and any recommended next steps. Reports help clients keep informed, build trust, and demonstrate the value of your services. Evaluate and refine business practices. Regular financial reviews include conducting regular reviews of your billing practices, expenses, and income to ensure the financial health of your practice. Use financial management tools or consult with an accountant familiar with healthcare and advocacy practices. Client feedback and continuous improvement is very important. Collect feedback from clients to understand their experiences and identify areas where you can improve. Adapt your services and offerings, pricing, and business processes based on this feedback to meet clients' needs better. Different specialty advocates can work together in a collaborative, interdisciplinary approach to provide comprehensive, patient-centered care that addresses all aspects of a patient's needs: medical, emotional, legal, financial, and logistical. This teamwork allows for better coordination of care, reduces the risk of gaps in services, and ensures that all facets of a patient's health and well-being are considered. Here's how different specialty advocates can work together to achieve the best outcomes for patients. Shared goals and communication. By establishing shared goals focused on the patient's needs and preferences, advocates from different specialties can work together effectively. Regular communication through meetings, case conferences, or secure messaging ensures that everyone is updated on the patient's progress, challenges, and care plan adjustments. Creating a centralized communication platform or care coordination tool helps keep all advocates informed, reducing redundancy and preventing conflicting advice. Coordinated care planning. Each advocate brings unique expertise, whether it's navigating insurance, managing chronic conditions, or addressing legal issues. Working together, they can develop a comprehensive care plan that aligns with the patient's medical, emotional, social, and financial needs. For instance, an oncology advocate may focus on coordinating cancer treatment, while a financial advocate handles insurance claims and billing, and a mental health advocate provides emotional support to the patient and their family. This coordinated approach prevents siloed care and ensures that all patients' needs are addressed holistically. Comprehensive education and support are very important to enhancing our clients' feelings of empowerment. Different advocates can educate patients on various aspects of their care, such as treatment options, medication management, legal rights, and insurance coverage. Working together, they can provide a well-rounded understanding that empowers patients to make informed decisions. For example, an elder care advocate may educate a patient on Medicare benefits, while a legal advocate helps advance directives in healthcare power of attorney, ensuring that patient understands their choices and can make decisions aligned with their values. Uniform information delivery. Advocates collaborate to provide consistent, accurate information to the patient and their family, minimizing confusion. A chronic illness advocate might explain how lifestyle changes impact health, while a nutrition advocate provides dietary plans and education. This collaboration ensures that all advice is integrated and mutually reinforced. Specialty advocates have their own networks and resources which can be invaluable when combined. For example, an LGBTQ and health advocate may have connections to affirming healthcare providers, while a mental health advocate may link patients to appropriate therapy and support groups. By pooling resources, advocates can help patients access specialized care, support services, and community programs that they might not have been aware of. In complex cases like those involving multiple chronic conditions, rare diseases, or end-of-life care, a collaborative approach ensures that all aspects of the patient's situation are managed effectively. An oncology advocate, a palliative care advocate, and a financial advocate can work together to coordinate treatment, manage symptoms, support emotional well-being, and address financial challenges. Coordinating insurance, legal, and financial advocacy. A medical billing advocate can work with a legal advocate to appeal denied insurance claims or address medical debt, while also coordinating with an elder care advocate to access Medicaid benefits or long-term care insurance. This collaborative effort ensures that the patient's financial and legal concerns are comprehensively addressed, allowing the patient to focus on their health and recovery without being overwhelmed by administrative issues. For patients transitioning between care settings, different advocates play vital roles. A hospital-based patient navigator can facilitate discharge planning and ensure continuity of care by collaborating with an elder care advocate to arrange home care and rehab services, while a mental health advocate provides support for adjusting to the new environment. Providing holistic patient-centered care. Patient care involves more than just medical treatment. It also involves emotional, social, financial, and practical aspects. An oncology advocate may address medical and treatment-related needs, while a spiritual care advocate provides support for spiritual and emotional concerns. Working together, advocates can create a care plan that addresses all dimensions of the patient's well-being, promoting overall quality of life. Collaborating with an LGBTQ and health advocate, an immigrant health advocate, or a disability advocate ensures that care is culturally competent, accessible, and inclusive, reducing health disparities and ensuring equitable care. Advocates such as mental health advocates, bereavement counselors, and peer support advocates can work together to provide emotional and psychological support, helping patients and families cope with the stress of illness and treatment. By collaborating, advocates ensure a continuum of support from diagnosis through treatment, recovery, and end-of-life care. Engaging patients and families in decision-making processes is enhanced when advocates work together to provide comprehensive information and support. This teamwork fosters trust, improves satisfaction, and leads to better adherence to treatment plans. Rare disease advocates can collaborate with oncology advocates or clinical trial navigators to identify clinical trials, research opportunities, and experimental therapies. This coordination provides patients with access to cutting-edge treatments and emerging therapies. Advocates can help patients navigate the often complex eligibility criteria and enrollment processes for trials or new treatments, ensuring they are all well informed about risks and benefits. That concludes the theory part of this course. Now's the time to take what you've learned and apply it to a real-life situation that you may be likely to encounter as a nurse-patient advocate. So it's time to get started. At this point, grab a piece of paper and a pen, because we're going to provide you with an opportunity to begin to think like a nurse-patient advocate. And at the end, you'll be asked a series of questions regarding the case study to reflect upon. Here's the setup for the case scenario. Mrs. Smith is a 76-year-old female. She's been living alone. Her daughter Mary lives 3 hours away from her and tries to visit her twice a month. Mrs. Smith lives in a 2-story home with a laundry area in the basement. Her daughter had recently noticed that her mom was missing some appointments. She also was beginning to mix up her medication times. She drives, but only to local places. She has high blood pressure and coronary artery. 2 days prior, she received a call from her mom's neighbor that Mrs. Smith had tripped and fallen on her right hip, and the neighbor had called 911. She was transported to the local community hospital where she underwent an open reduction and internal fixation of the right hip. Mary arrived at the hospital and was staying nearby to be with her mom. Mrs. Smith was recovering well on the orthopedic floor. Mary was concerned about her mom continuing to live alone 3 hours from her. On the second day, the case manager had called her to discuss discharge planning. 4 hours later, Mary received a voicemail from the case manager that her mother had been transferred to the ICU. Mary was quite concerned because she was recovering well without complications just in 4 hours before. Mary arrived at the ICU and saw her mom laying in the bed with several IVs, oxygen on, and a Foley catheter in. She felt fearful and uncertain. She felt some guilt that she had not arrived sooner to help her mom. It took some time to find the nurse. The nurse explained that she had a blood clot in her lung. She explained that she would require medications to kind of break up the clot, and she would be monitored closely. Now Mary was even more concerned. She decided she needed to do some research about hiring a patient advocate because she did not feel comfortable trying to navigate her mother's care at the hospital. The fudge factor. I want to talk a little bit about this because it's very important to understand what drives a client to reach out to request services of a nurse patient advocate. Unlike a customer who's motivated to enter a store to purchase something they need, clients who reach out to us are usually in an emotional crisis. Identifying those emotional needs is key to changing the call from a consultation to a contracted client. We use the fudge factor to identify and reflect on a course of action to alleviate fudge. What does fudge stand for? F is for fear, U is for uncertainty, D is for doubt, G is for guilt, and E is for exhaustion. Let's talk about what you would be thinking as you took an initial consultation call from Mary. As an advocate, it's very important to identify the why behind the call being placed to you from Mary. It's based on her point of view of the situation. What's her emotional state? Identifying her emotional needs and addressing how to alleviate those emotional needs is what she is looking for. That's the fudge. So how do you begin to do that? Start by gaining her trust. How do you think you can do that? Next, begin to tackle the tasks you need to do and include Mary in your plan. Make her a part of your team. How do you think you can accomplish that? As a part of this exercise, lastly, list all the ways that you could continue to advocate for Mrs. Smith and her daughter going forward. Healthcare navigation becomes key here. Identify ways that you can collaborate with different members of the health team. Here are a list of additional resources for you if you want to learn more about patient advocacy. Practice makes perfect. To further enhance your learning experience using real-life practical approaches, we offer a nurse patient advocacy coaching and mentorship program. It's designed to meet the needs of nurses who wish to create their own business or learn how to successfully work as a nurse patient advocate as an independent contracted. Students are coached and mentored one-to-one by the owner of Stepping Stone Advocacy Services, which is me. I've been an RN for 40 plus years and a certified case manager for 20 plus years. I developed this training program and the coaching program to share with other nurses looking to pivot my firsthand knowledge and experiences as I waded through this new territory as a nurse patient advocate and a business owner at Stepping Stone Advocacy Services. Thank you for your interest in nurse patient advocacy. Please feel free to contact me on my website if you have any questions. Becoming a nurse patient advocate is the most rewarding job that I have ever had, and I wish you well. Thank you.